Test, test. Mic test. 4, 3. Test, test.
It's 12:05 on December 4th, 5th, I mean. We can start our governance committee meeting. I don't believe we have anybody registered for the for citizen speaking, so we're going to move to the next item, which is number 3, approval of the minutes. Anyone?
Move to approve.
Second. All in favor, say aye, signify aye.
Aye.
Any opposed? Motion pass. The next item is the corporate governance update. Our Chief Compliance Officer. Welcome, Colin.
Thank you. Thanks for having me. Pick up where we left off during the last governance committee meeting, overview some of these items. The big ticket item is up there on the top, the managed security services. We do have an board-approved contract for our MSSP vendor, so that is exciting news for the district that we're able to outsource our cyber environment to more 24/7 with active threat hunting. So I'm feeling very bullish on that, super excited about that. On the bottom side, coding and billing related items, the inpatient short stay is a risk that's been adjudicated and removed. Our error rate was less than 2% when we went and did the audit, so congratulations, Dr. Patar, good job. And we are still actually working on the ventilator audit currently, and so that will appear on the current risk register. Bottom side first here, ventilator risk, as I mentioned, is one that we're working on currently. Everything else up here, I'm not going to spend too much time on because there's presentations on all of these throughout the presentation today, so you'll get detailed information on all of them. I will move along to the governance work plan, which should be in your red folders. Governance work plan is the annual audit plan for corporate compliance, internal audit, the governance division of JPS. Its purpose is to align with U.S. federal sentencing guidelines and Office of the Inspector General expectations of an effective compliance program. We want to be continuously reassessing risk and prioritizing risk effectively and maintaining communication with our leadership and with the board as the work plan goes on throughout the year. We have our top 5 risks in the register, which I just showed you some. That is part of the plan as well, as is our audit activity. So we want to see a continuous improvement model as part of our governance work plan. Our goals this year are similar to years past. We do not want to overspend risk. So we want to do a really good data quantified job determining what is a risk for the organization and then build our plan off that. For the plan, which you'll see on the next slide, it really is theme-based. So it's those items in the regulatory climate, which we're seeing kind of over and over again, health system to health system. And so if it's thematic, then we put it on the audit plan. So that's what you'll see on the next slide. We do also want to demonstrate DOJ level compliance program effectiveness, and what they're looking for is adequacy of our program design, that we're sincerely applicating it and that it actually works in practice. And we do get audited triennially. That is happening currently. And so there's an assessment of how well we do that, which should be coming to the board maybe in the next meeting. This is the prospective audit activity for FY25. This has been approved by the Executive Compliance Committee. It's now coming to this board for approval. I'll ask for a vote a little bit later today. It is required to be approved as part of COM 9000, our corporate compliance program, to be board approved. The themes we'll see for this year are cybersecurity and data protection, revenue integrity and financial compliance, and then always there's a risk component to it. So we want to leave some room here for items that come up throughout the year. And I would also point out that these are prospective activities. If something arises that is more of a risk than one of these things, we'll swap it out. So it is fluid. It's not a snapshot in time. As a reminder, we do use a likelihood versus impact model and data to quantify what constitutes a risk here. When it gets below an aggregate score of 3, that's the point at which I can go ahead and accept that risk. If it doesn't get below that, and certain things won't ever get below that, it remains on the risk register and we continue to work on it.
Before you go on to the next section, with the new administration coming in, do you foresee any adjustment to any of this activity that we might want to focus on?
Unclear.
Unclear this time? Okay.
So the Department of Justice, as has become an annual cadence, has updated its compliance program guidance for hospitals. So as a reminder, this is about a 5 or 6 page document that the Department of Justice kicks out for its prosecutors, and really what it is a series of questions that they are supposed to be asking of organizations that find themselves in regulatory issue in order to determine if their compliance program is effective. And our compliance program here, and most others of my peers, is now built off reverse engineering that particular document. That is the content of what a corporate compliance program is. The structure is based on the OIG model, so that's your 7 elements of an effective compliance program. And so when the DOJ updates its guidance, we will do an evaluation and then a corollary update to our compliance program as necessary. So you will see that sometime next year come back before you for approval with some of these items, but I did want to raise them so you're aware of what they are. There are 3 new focus areas of the DOJ. One is AI and emerging technologies, and that we have policies to manage and monitor risk. Data analytics, that we're leveraging in the compliance program context, data to improve our monitoring and effectiveness and oversight of the organization. And then that we have really robust whistleblower protections and anti-retaliation policies, so we're able to determine noncompliance internally before a regulator comes and brings it to our attention. I would mention, and I don't want to bear the headline here, we're pretty much doing all of these things right now. We're going to have some minor edits, but a lot of these are things that were not a surprise to us and that we've been thinking about for quite some time. And so we do have stuff that was already in flight before this update even came out from the DOJ. So happy about that. I did want to highlight a few things. So the DOJ's emphasis on AI risk, and this is big nationally, it's big in the state of Texas. This concept of what we're going to use emergency technologies for in healthcare, Will can speak a little bit more on when he comes up. So if you have complex technical questions, please hold those. But from the DOJ's standpoint on risk, they want to see comprehensive oversight specifically of AI. Risk identification, that we're assessing pre-implementation, what the impacts might be, that we have controls in place, and that we have a governance structure. So Will had some AI things in flight, and it was a good time to take some of these principles and questions that the DOJ is asking and fold it into our approach to assessing AI. So I will let him speak a little bit more on that when he comes up. The other 2, data analytics. What the DOJ's expectation is that compliance teams have full access to data resources and tools. We do have a fair number of analytics tools that we use inside the compliance department. MD Audit is our coding software, for example, and Bravado monitors Epic from a privacy standpoint. DRADA houses our corporate compliance program and documents and third-party oversight. Streamline Verify is a background check software. Navex is our hotline. COI Smart manages our conflict of interest, and then we have Autovate, which does some audit stuff, and then we in the compliance department have access to other people's tools here as well and can tap into those, as well as pulling reports direct from Clarity. So I think access to data, generally speaking, from my several years here at this point, has not really been a challenge. We do have good access capability and tools. It's just making sure that it's always unfettered. And then the second piece here is the whistleblower safeguards. We do have a draft policy in flight which does a better job of defining what retaliation means, which is, I think, something that has been a want of mine for a while, and that ties into the hotline as well. And that we do some training on that, which is already part of our annual training. Questions?
Yeah. Colin, are you proposing any changes to the anti-retaliation or the whistleblower policies this year? Or is this just a kind of a recitation of how they are?
It'll be slightly updated, and it may actually come through HR committee because it's an HR policy.
Okay. At some time, I'd like to see those policies.
Sure.
In terms of access to data type thing, I'm pretty sure we have a lot of audit trail and everything else internally when we use a third-party vendor, especially around appeal process or coding type thing, do we have enough access just in case to know to follow the audit trail type thing?
I'm going to take that as a contracts maybe question. I think, my understanding is, do we have the right to audit the third-party system?
Do we have enough access to have the ability to compile a more accurate audit trail?
I believe we would. I believe we would. All right, Will, the show is yours.
Next item is the Information Technology Services. Welcome, Will.
Good afternoon, everybody. There we go. So we've just finished this year. On a yearly basis, we do an information security audit. We just completed it actually in September. It was done in June, July, back and forth, so we just have the data now, bringing it forward to the group. We utilize an organization called Clearwater, and we generated the audit based on the NIST standards for the cybersecurity framework. Pretty standard within the organization. Pretty standard nationally to be able to use these as the benchmarks. Actually, we had a tremendously good audit this year. You know, I'm just ecstatic, and you can tell the exuberation's flowing. But I really, truly am ecstatic that we had such a good audit. Yes, ma'am. And we'll go through why it was such a good year, but I wanted to first address that the major categories that were rated on everything from identity to recovery, we are addressing. We have plans in place, majority of them around when we change from the MSSP. We have been a major focus on detect, but that doesn't necessarily mean that it won't be providing services around protect and identify as well. And then when we go to cloud, protect is a major issue, which we'll talk about in a minute, but it's going to impact everything.
Could you take a minute to explain, because some of us may not understand conformance and non-conformance?
I'm sorry, conformance and non-conformance?
Right, just in case.
Conformance means we meet the standards. Non-conformance means that basically the NIST standards have not been fully met. The standards are pretty straightforward and they're binary in nature, so you either complete them or you don't.
Okay.
Now, the significant findings were few, but the importance of the significant findings, and I apologize, that upper right-hand square should say fiscal year 24, not 23. The significance of the findings was last year, we didn't have processes in place. This year, we didn't have the documentation around those processes. So we've come a long way, a very, very long way. Our only really significant finding around integrity failure was access control. And quite frankly, it's a standard one. We have issues in this organization identifying individuals who've left the organization, removing them from access. Now, that doesn't necessarily mean that we don't have processes in place to limit access. If an individual's has not had activity on the network over 6 months, automatically then they get deleted from the system. So those integrity checks are there. They're just not as clean as what an auditor would like. I need to change gears and set the stage for a different conversation. So you know that we are moving to the cloud. And in the context of moving to the cloud, we've launched that effort. And there are basically 4 phases. The first phase is to build infrastructure. And we're going to Azure Cloud. Azure refers to stamps, and stamps are nothing more than a repeatable process. So our first stamp is rolling out the basic infrastructure. That'll take about 115 days. Then we go to the second stamp, which is all the DR components, and that's the DR for Epic and all the ecosystem that surrounds Epic, PACS, etc. The third stamp is we're do prod, epic. We maintain an active environment. We'll be moving prod, and we'll also be moving that ecosystem. At the end of that, we are planning for not having a data center within this organization, which means that there are still cats and dogs that live in the data center, where the vendor has said it has to be local. So we've got two choices. We're going to be going back to those vendors and saying, do you have a cloud alternative? Great. And if not, then we're going to be going out to RFP because we've got to get out of the cloud. Now, and I apologize for the coloring. It looked a lot better on the PC than what it did when it's up on here. Who knew? There's a couple important points here. This is what our cloud structure or security structure is going to look like after we go to cloud and MSSP. 18 months ago, we had a third of the capabilities and the controls in place. What's representing here in the dark and the light blue is what's existing that we've been putting in through the last year with the Cisco MDR. Or the middle blue, the middle square is what we come with XDR, and then the light green represents what's net new as we put in the cloud controls. The point here is there is a significant period of time over the course of the next year, this year, coming calendar year, that we're going to be focused on redoing all our systems. So I go back to the point where I'm not really too worried about documentation or being dinged, so to speak, in the audit for not having documentation, because all of my systems are going to have to be retouched, all of my systems are going to have to be revalidated, and all my systems are going to have to be redocumented. So by the time the audit comes around next year, we should be in a should be even happier than what I am this year. So as I said, as we're moving to the cloud, we've got a couple mantras here. First mantra is nothing's going to be left behind because we don't have a data center to put it in. The second mantra is we're not going to leave anything hidden under somebody's desk. And we do have systems that are department owned. And quite frankly, what we're going to be looking at is going out with a series of programs to be able to identify what exists out in the public, so to speak, our organization, non-IT, the public, identifying it, sitting down with the organizational owner and telling them we've got a choice here that's going to have to go to the cloud. How are we going to do it? Having a decentralized control but centralized security, i.e. nothing gets past management at this point in time of security. There are systems out there that quite frankly we don't know whether they're patched, we don't know whether they're managed, et cetera. So we're going to be drawing that in. Now we're going to be doing that by creating two governance groups, one around infrastructure council within this organization to go from everything from what wiring do we use in the organization to what carts are we going to be leveraging to put computers on, so that we have a complete understanding and a common language associated with what are the controls within the organization, what standards. And that's going to be extremely important because we're at a point now where we need to delineate what are our standards in this building, and more importantly, what are our standards going to be in the new facilities that we go live in. Because if we leverage the existing standards, many of the things we want to do from an ambient AI, from other technologies, IoT, et cetera, aren't going to work in that environment. So now is the time to start getting that set up. The second group is really a department-based technology council where we're going to be coming together and talking about how are we going to move your systems to the cloud, and then how are we going to control the security associated with it. And again, and this isn't Big Brother coming around slapping people around, but this is Big Brother coming around slapping people around and saying, we're going to manage the security and we're going to ensure that the organization is taken care of. If you remember, back in the summertime, I was here and we gave an update associated with UT Southwestern where they had a department level system, but they had a data breach. This is exactly why we're driving this department-based technology council. Questions?
What is the time frame if you identify some of the apps that cannot be moved over to the cloud?
If it can't be moved over to the cloud, we're going out to RFP.
So this may take all the way to 2026, 27?
So we're assuming that Yes, we've accounted for, we've got a year's worth of plan to move everything to the cloud. Then we assume that it's going to take us at least a 2-year process post-cloud to getting the rest of the applications into that environment. And we'll be maintaining the co-location for the next 2 years in order to be able to make that happen.
If they can't, can we get out the contract before we move to the RFP type thing?
If you're talking about the
Under
application,
contract,
can we
right?
get out of the contract? Most all our contracts have that 30-day out,
30-day out.
that notification. If not, then we may end up having to eat that cost. But by the time we get to that point, I'm assuming that eating that cost is very limited time.
Is there a workaround plan that you can move some of that into our own environment?
I'm sorry, I missed that last one.
Because I'm assuming you move to the cloud for better control, security, and everything else. But if they can't, in the meantime, can we move them into, should we look at the workaround and move them into our environment to be better protected?
That is part of the desire, yes, sir.
Yeah, Will, I have a question. Other than Epic, what are the major databases or applications, the major ones that have to go up to the cloud also? Because you're saying everything's going to go to the cloud. That sounds like a big task.
Yeah, then we've got a lot of systems like imaging-based systems, PACS in particular, or some of the oncology equipment, et cetera. That's it's all going to the cloud. And then there's minor systems like Seaboard, which is our dietary system, everything. So we've got about 16 identified systems within the ecosystem that have to be moved up. But that's a little bit of a misnomer because we've got one Epic, but we know that one Epic is about 400 some modules.
So will Epic be the first migration?
Epic will be the first migration with the ecosystem, and we're not looking at it, we're not moving the systems based on type of system, we're moving the systems based on what their functionality is. So we're moving all the DR, Epic and the ecosystem that are the DR systems, the business continuity, disaster recovery, those are the ones that we fail over to, up to the cloud first. And then we're moving the prod systems. And then when we move the prod systems, we move Epic and that ecosystem at the same time.
And you're using Azure for all the systems? You said there were 16, I think.
We're going to be going to the Azure cloud. We picked Azure for several reasons. Strategically, Epic has been focused on moving to Microsoft Fiber, which is their data system backbone. They've been pushing to move all their databases to Azure, so it only makes sense that we become an Azure shop and align to that strategy.
Okay, thank you.
Sir.
Do we, I guess I'm going to ask a general question rather than a specific one because I don't think we can zoom in on a specific one. As you move most of those apps over to the cloud, usually they will start charging by user seat rather than by computer, right? Is that going to materially change?
No, we're not going to have that issue. We're not going to have that issue. In fact, we expect that there'll be some significant cost savings once we get there, because one of the things we haven't done with our systems is actually done data lifecycle management. And when I moved to the cloud, I'm sure you're familiar with the cold storage. The ultimate at rest data is pennies to the dollars.
From the hardware standpoint, but from the application standpoint, is that going to add additional costs?
No, sir.
Per user.
And we're already starting to work with our vendors to be able to ensure that the contract language is there to be able to move us.
Okay, good, thank you.
So I guess the humor part of the program's over.
Will,
Oh, I got one more, yeah.
yeah, let me ask you one other question. A job that's this monumental and moving, did you say 16 systems?
16, yes, sir.
16?
16, 16, yes, sir.
Okay. Are you meeting any resistance from, people that they may have their favorite system in their favorite place and I would expect
We are having forceful dialogues with some individuals.
forceful dialogue.
That's the fun part.
I would expect, as big an organization as JPS is, and moving everything to the cloud, you'll have some folks that have their favorite systems in their favorite places.
Well, the majority of the issue and the pushback is the lack of understanding what the cloud is. And the cloud is nothing more than somebody else's data center. So the functionality doesn't change, the access doesn't change. What does change is the controls. We've been very lax as an organization, the controls associated with security at the department level. That's no longer an option. We put them to the cloud, they have these controls, and the organization has to manage and operate more efficiently as an ecosystem, which means that people can't be doing unilateral changes. Part of what the governance process is to set up is to be able to have those process controls in place, to be able to understand if John Doe is going to be making a change on their system, what's the upstream, what's the downstream consequences, and setting those mechanisms in place. They don't exist outside of IT at this point in time. I've forgotten, I apologize, I have one more slide. And Colin was kind enough to remind me. Just as he said, there's a lot of change at the federal level. There's been a lot of change at the state level in terms of AI, and the state has some tentative language that they're going to be pushing forward. The goals and the requirements aren't surprising. They want to be able to ensure that the efficacy, the ethics associated with how we use it, why we use it, are there. It will impact us because they go through a classification system and identify high risk. And let me read to you how they identify high risk. High risk is any artificial intelligence system that, when deployed, makes and/or is a contributing factor in making a consequential decision. So just about everything we're going to be doing with AI in our organization is going to be high risk. We anticipated that there would be a need for audits and managing on a regular basis, looking at the algorithms, et cetera. What we didn't anticipate is that legislation is going to be required that any substantial change, now, how do you define a substantial change? But any substantial change to the code or the product itself will require an impact statement, which means that if I do an upgrade, we're back to square one. We always plan to do the analysis regarding the safety of the tool and the efficacy related to the language model. But the impact to us is it's going to be labor, because we're going to have to do more analysis on a regular basis. What is that impact? How do I correct that impact? How do I address that impact? We assume that from a secondary consequences that we're going to have to be telling folks that we use AI. There will be legislation that says so. If we do that, that means that we're, again, one more item to the consent form. So we expected the controls, whether it was inventory, algorithm, or data security review. That was pretty straightforward. We knew that risk management in the form of governance was a requirement, and we've been setting up that governance process and even the disclosure. But like I said, what we didn't count on really is the resources, the impact for the statements and the auditing that the state is expecting. And they're allude to penalties, but it's unknown what those penalties will be. Questions associated with where the state wants to go?
Well, I have a question for you.
Yes, sir.
Because you're looking maybe 10 years ahead from all of us here. And the challenge with AI is that is our organization culture ready to embrace it? Because we have to upgrade our skill set also as well, right? Because it's not because of the type of patient that we have. Some lack language, some lack, all kind of social determinant of health challenge and everything else that you see out there. And you're using AI to move, or because it's a language model, right? Mm-hmm. So whatever you input it in, majority of the time it's going to be on the other side of the spectrum, where the population that they serve is different than ours. Are we prepared to challenge, put the right input to service our own population to move forward. Otherwise, we're gonna trip over some of these things also as well, because we're gonna be cherry picking patient. The most compliance one go first and all that stuff, because they're gonna use social, what do you call it, psychographics data, right?
I
So
think
they're
it's,
gonna go in there and say, okay, this one based on their, as a smoker, they do this, they have this phone, this device and all that stuff, and they're gonna move, and they're gonna say, based on this, move this population first. That may trip over the population that we have left behind.
I think there will be an awful lot of ethics questions that are raised with this. I think it's going to be very analogous to precision medicine. We're going to have to get an understanding of what is the focus group and what is the focus point that we're mindful of and also watching. Just as in precision medicine, if the database is too large in terms of trying to look at the algorithm, we're going to have significant issues in terms of how do we apply that algorithm. So yeah, I do think we set the stage. I think there'll be bigger questions that before we get to that, I think there'll be larger questions that will be raised. Right now, we have large language models that are basically clean. Be prepared for two issues. I think first issue is at some point in time, somebody will understand that I can attack and or ransom the model itself or dirty the model and get monetary gains for that. So we have the potential in the next 5 years of starting to see the pristine models go to very ugly models, and then we're truly questioning the value. The second piece of it is, can the models be sustained? Because what the models are doing now is starting to feed upon themselves.
And that's the scare. I mean, you hit all the areas that I was looking at, and that's what scared me, because is our institution ready to upgrade or retrain some of our team members to be able to keep
Yes,
up
sir.
with all that technology, to make it clean and early detection? It's
Indeed. So we hope that nothing happens to 15 years from now, and by that time, we're all gone.
because precision medicine been around for a long time. All that company, I would say about 80 to 90% is part of United Healthcare. So
Yes.
they stopped literally stopped all the innovation when they pulled together like that. So you have to go through that cycle again. Okay.
I did have a question because, on the other hand, I am kind of excited about the possibilities of AI. Granted, I know there's a lot of risks that we have to go through, but how is JPS going to go about deciding which applications we do decide to use?
So we have a process that's been developed around looking at AI, but also breaking AI into two distinctive groups. There's AI associated with more or less business activities, and there's AI associated with clinical groups. And I'll focus on the AI from the clinical groups. In the clinical side, basically understanding that what we're talking about is a research question, and bringing in the right folks to look at that research question. But we have a very comprehensive documentation around how we walk through the questions that need to be asked to ensure that it is appropriate. We also have a very clear process that if it's not appropriate, how do we manage that? The bigger issue now, like I said, is how do we audit it on a regular basis, and we're still working that out. That'll be a little tricky because now the question will become, who are we auditing for? Are we going to be auditing it for the feds, or are we going to be auditing it for the Texas government? But yes, we have a fairly clean process.
And I'd be interested if we ever consider doing like an AI governance committee with
Actually, we've
physicians
had several meetings. We're pushing that forward.
because there will be a lot of clinical tools which could be very useful after we move into the cloud that we can take advantage of if they're vetted properly.
I guess the question is, at what point does this committee needs to pick that up to see, to make it bring more clarity to, is it financial impact or clinical impact?
Yeah.
And where's the rules of engagement is? Otherwise, it's a free-for-all type thing.
So we're in our second round of documentation and process fine-tuning. I think that if we can get through this process, then happy to bring it back to the group and talk through what is the tentative policy, what is the tentative process, what are the tentative tools that we're utilizing.
Is Epic in this space at all?
Yes, ma'am. And we've been leveraging Epic AI for quite a while.
Okay. I was going to say, I thought we were already kind of in that.
Yeah, they're building a lot of tools which could be very useful for daily physician tasks and stuff like that, that could work, especially when you move to the cloud and all the data is in one area and gather it. One for analysis, seeing which populations are being affected. We do all this population health stuff for different disease processes. You could easily, do that. And then as simple as documentation. Daily documentation becomes a lot easier. It picks up mistakes. It picks up a finding in the chart that you didn't document, and maybe it's going to bring it up to you. Was this missed, or do you need to address this? So things like that. A lot of applications for.
Ultimately, what we want to do is start progressing away from using AI to find work to AI trying to minimize work.
Yeah.
And you're right. There is the ability now that we're going to be looking at to how do I go reach back into Epic to pull out key information to be able to do various reporting right off the bat. But the ambient AI, when we actually get to the point where we've got more of a EMR that is voice interactive.
Yeah.
Which will be our real savings.
Yeah, that's the part that's going to be very tricky.
Yes.
Because I think from a data perspective, when you look at the data, analyze it, predictive and all that stuff, it would be nice to have AI, but when you cross over to point of care, and it's like, you may miss this, but if somebody put it in because it may increase my bonus or tie to the revenue and all that stuff. So that's where the problem come in. But on the surface, people can look the other way, but it can say you missed this because the recommendation of what you should be looking at is another challenge.
And I do want to make sure everybody is a realist as we go into this journey. Right now, we do not have the infrastructure to be able to manage and support a lot of the AI capabilities. AI, particularly ambient AI, where I'm using RTLS, I'm using video, I'm using voice, and I've got a network that's not secure and a network that can't handle that bandwidth. It would be idiotic at this point in time to roll out some of these AI activities. And to that point, then there's an awful lot that we're going to be forced to hold off on or maybe do pilots until we get into the new facility.
I think when I start crossing over the point of care, we need to be alerted ahead of time so that we can look at from that perspective. I don't think IT or any area can do it alone. Mm-hmm. Okay. On your plate, sir. Compliance.
Will, do you know who's carrying or promoting this draft bill in Austin?
Yes, I do.
Or Ashley?
Ashley.
It's Representative Capriglione from Tarrant County, Giovanni Capriglione.
That's right. Thank you.
I don't know if you recall, but he carried the privacy bill a few years ago in the state, and is really considered the expert in terms of emerging technologies and artificial intelligence in the legislature on both sides, the Senate and the House. So this is his draft bill.
Okay, if we're not happy with the bill, we need to visit with Representative Capriglione and get to where we are happy with it.
So we, sorry, go ahead.
I don't think collectively we're unhappy with the bill. We're just pointing out what the impacts are going to be at this point in time.
Correct. And we've, through our activity and involvement with the Texas Hospital Association, as well as Teaching Hospitals of Texas, for which we're members of both, we've already provided a first round of initial comments to Representative Capriglione based on this initial draft that he gave a few weeks ago.
Yeah,
Will, do you
So-
sit on any advisory
Yes, ma'am, I do.
around this? Okay, yeah, there's usually advisory this around.
So it'll be an ongoing discussion. I mean, there will be numerous iterations of this bill through the legislative process. This is really the starting point, if you will, prior to the legislative session.
the privacy bill was replete with problems, and I had a conversation with Representative Capriglione, and they did put a lot of exceptions and exemptions in it to make it less onerous. But I think he's probably willing to be flexible if you see things that would be, harmful to JPS.
Agreed, yeah. He's very much an open door in terms of, comments, feedbacks from his constituents, for sure.
Yeah, a lot of these things can create huge liabilities down the, problems you didn't think about when you wrote it.
Exactly.
At this point in time, the 41 pages of the document are pretty broad strokes.
How long is it?
41 pages.
That's a long bill. Yeah, the privacy bill was like 2-3 pages. It wasn't that long.
Wasn't that long.
Does it all roll up to CMS or DOJ?
At the state level, I don't know the answer to that.
I mean, down the road, it has to be compliance with federal rules and regulations.
Well, I think that's part of his motivation. He's trying to get out in front of what the federal government may impose or mandate in the future. He's wanting to craft legislation at the state level, again, to kind of get out in front of what may be coming down from the federal level at some point.
And the federal government will be coming from CMS.
It's there. It's the IT office there.
Yeah, so yes and no. I'm dancing with this because CMS has said that they have defined what the criteria is. CMS has said that they're going to be following NIST. CMS has said what their requirements will be, but they haven't said what authority they have and how they're going to, how they're reporting their authorities.
Good question.
What I find interesting, and this is just a summary of it, Will, but there's nothing in these 6 points for this act to deal with the accuracy of AI. It deals with discrimination, but there's nothing to do with accuracy. And I don't know what y'all's experience is. My experience with the AI generators that are being promoted on the browsers is you get as many wrong answers as you get right answers.
I think the other area you're going to see this come up is in physician documentation. So you alluded to ambient technology a little bit, and it sounds like it's somewhat cost prohibitive. But I will tell you, in the Metroplex, there are physicians, not at JPS, taking their devices into patient rooms for documentation purposes, and they do very well at recreating the patient visit in a fraction of the time that it would take us to document the note.
Agreed, and when I talk ambient, I'm going to the next level. I'm talking about the ability for when a nurse walks in or somebody walks into the room and provides medications, that's actually documented in the system.
Yes, and I think that is the future. And I don't know that JPS is always going to be the forefront of technology and the forefront of evidence-based care, but I think that we're going to see the Baylors and the other institutions instituting this at a patient care level very soon. And I think it's important that we keep that in mind as we move forward as an organization, that the physicians will want this, the patients will want this, and it will be helpful to efficiency.
Agreed completely, and like I said, we've got a ton of projects already slated to be able to roll forward. But some of the larger expectations that are equivalent to a Baylor, some of the dictational capabilities, we just can't support based on the network that we've got. So there'll be a trade-off. What can we afford? What can we not afford?
Yep.
Because a lot of it will require replacement, and then do we replace or do we just wait?
So what kind of timeline, Dr. Kirby's point, what kind of timeline would we do? At what point will we have a system that can support this? Because I do think we are going to get residents and new docs in here that have trained on these systems, and
Well, we've got an RFP out at this very point. Part of it is standardization. So we've got 3 different RTLS systems at this point in time. We've got multiple camera systems. We've got very limited standards around what technology we use for microphones. So part of what we're doing is getting that in focus now. We've got an RFP out so that we can establish some of those and then go case by case. Do we take 3 West or 3 East and, build it out because we have a specific need?
going to be an expectation.
Thank you.
Thanks, Will. Thanks, Ashley.
All right, so 8 years ago when I entered one of this world, we didn't talk about this at all, and now it's pretty much all we need to be talking about. So it's an interesting evolution of what it means to be a compliance officer in healthcare in 2024 and 5. So a word on evolving sophistication, just before we move on from that particular topic as it relates to oversight. So the board is aware we're in the 5th and final year of our co-source audit contracts. This is our outsourced internal audit function. As a reminder, our 2 vendors right now are Kodiak, which is formerly Crow, and KPMG. They have a tremendous amount of capability to do financial and operational audits, but what we've seen over the last year and a half, 2 years, the capacity to handle the cyber side audits is just not there right now. And so as we go forward to do RFP, which we've created and is being vetted with legal right now, is we will split that focus. So we'll still have 2 co-source audit vendors that'll handle our operational and financial audit, and then a second RFP that will handle cyber, and that's primarily right now to provide oversight of the MSSP vendor that we're bringing on. But we'll also have some capability to do some more sophisticated auditing of the entire environment than we can right now, because it is not a skill set that we have internally, nor that our auditors have internally in their operations either. It's really needed and very kind of a niched sort of thing. So that'll be coming in the next fiscal year. On happier news, it was Corporate Compliance and Ethics Week a couple of weeks ago here in November. Wanted to bring this forward to the board, just so you know. I know it's a priority of the board chair to do more, and the DOJ and OIG both have a global desire to see more done around incentivizing compliance. Not a punitive approach, but having the organization want to participate in the program. As part of this, we had some events, we had some trivia, we had 10 compliance hero nominations come out of the week. We had 136 submissions for trivia, and the team went out and visited 23 departments and clinics, and so it was robust participation, and we were pleased with the outcomes. Here were a couple of the activities. I'll let you digest those. And what the outcome of this is that we had some giveaways. Everybody likes their JPS coats around here and shirts and whatnot. So we're giving away some coats, and it was very well received amongst the team. And what we would ask is for some participation from the top. So they came in today, I was informed. And so we will coordinate, probably Blake and DT with you, to go hand some of these out and get with our communication staff, because I think it's important that all the way to the top that we're celebrating people that participate in the compliance program in a positive way. Want to recognize those people and would appreciate any support you're willing to give us.
Are you going to give the committee the 10 trivia questions?
I will. I'll provide them to you. Are you going to get them all right, Blake?
It would probably not be ethical for you to give me the answers, but
Would not be.
it'd be good to see the questions.
And we are coming into the next calendar year. So just a word on compliance education. We do have annual compliance education. It's done primarily by computer-based learning, tentatively scheduled to launch, as it always does, in January 25. One of the new additions for this year will be a first time we're doing a specific standalone drug diversion course. We've talked about that a lot over here in the course of the last couple of years, but specifically in the last year. It is a best practice. I'm excited about that. It's quick. It gives the organization what it needs to know, primarily to identify behaviors associated with diversion and understand better what it is, which makes patients safer, it makes staff safer, it makes the entire environment of JPS safer. So I'm excited about that inclusion. We do have the staff out participating in new employee orientation, new provider orientation, new resident orientation. We are out there doing hotline education. You'll see our flyers in every clinic and every business unit in this organization. We provide coding and compliance education both inside of my shop and as well on the revenue cycle side, which is a really important piece of where that should be coming from, and that should be a more or less continuous feedback loop in that fraud, waste, abuse environment. And then we do targeted education sessions as needed based on findings. So we're out there to a great extent doing the best we can to educate on risk, more or less constantly, not a one-time deal. So I will.
Do we need to add board member for compliance training or continuation?
We do, when is it, February, I think, that we do the board member education?
We usually do it in first quarter,
February,
yeah.
Board- okay.
Turn it over to Dave.
Okay. Going to, I know, are you going to click for me, or do I have?
Go.
Thank you, Colin. So this is just an update on our enterprise risk management activities. I think we last time presented our enterprise risk management plan to this committee. It has been approved by the Executive Compliance Committee. As a reminder, our enterprise risk management team includes our workplace violence manager, our legal claims manager, and our policy team. So we oversee all of that, and also our workers' comp. We introduced the plan back in August, and then we were moving on to do our annual risk assessment. We got that information out to the executives in August as well, and we conducted our survey in September and October. And so we were then compiling our results. I have Renee Garcia here, who is our enterprise risk manager. She worked closely with her coordinator, Agogo Mafoya. Agogo decided that she was going to have a baby before this meeting, so she's not here today. But they did a lot of work on this. And so our goal was really to wrap this up and then kind of present those results to this committee. So our questionnaire was sent out to 73 directors and executive directors, and that included all departments, including inpatient and outpatient clinics. We had a pretty good response rate, 48 completed questionnaire responses. And really, the goal here is to take those risks that we have identified as top risks for the industry using external information and applying that internally to get our leaders, our internal leaders, to prioritize that as they view it from the internal lens. So this is some of the information that we relied on in gathering the list of external risks that we would circulate to those leaders. We gathered some from the CLO and GC perspectives, from Protivity, and then we also used Aon for their list of those top healthcare risks. Our framework is based on ASHRAM and COSO, the Committee of Sponsoring Organizations. They kind of set this continuous improvement framework where you map out your risk and then take those to prioritize it for a continuous opportunity to provide some flexibility where needed to protect and create value for the organization. So in the assessment, what we did is we asked leaders what they would consider to be the top 5 healthcare risks from the list below. The list was, again, 10 of the top risks that were identified on those external surveys. That included cyber threats, rising healthcare costs and labor costs, ensuring privacy and compliance with growing identity protection expectations, challenges in sustaining culture due to changes in overall work environment, ability to attract, develop, and retain top talent, adoption of digital technologies, which would include AI, heightened regulatory changes and scrutiny, failure to innovate or meet patient needs, regulatory or legislative changes, economic conditions, including inflationary pressures. And then applying our methodology to see how leaders were ranking each of those from a number 1 through 5 perspective and weighting that. This is how we came out. Cyber threats was at the top. Ability to attract, develop, and retain top talent came in 2nd, and rising healthcare costs and labor costs came in 3 from their internal perspective. So we applied a weight because, since they were ranking these, you'd get a 1 through 5, so we had to assign a value in order to determine which one was actually at the top there. So on the left, that's kind of the scoring methodology.
Out of 5?
Not out of 5, it was more of a weight. So when you applied that and did the average, so the number is actually meaningless from either the number of people taking the survey or the actual place that it's set in. It was more of a ranking kind of process. We probably should just left the numbers off.
so that it wasn't confusing. We also asked leaders about other risks that they had concerns about, and those additional risks that were on JPS leaders' mind included workplace violence, both from a situational awareness perspective and violence and attacks on healthcare workers, impact of artificial intelligence. We've already been talking a lot about that, and then patient and employee safety, including work-related injuries. So as I mentioned, the top 3 risks from the survey ranking perspective were the cyber threats, the ability to attract, develop, and retain top talent, and rising healthcare costs and labor. And while, even though these bubble up from an enterprise risk perspective, most of these obviously won't be owned or driven by the enterprise risk management team, but what they will do is take the comments and concerns that we're reflecting from the surveys and circle up with the individuals that actually do oversee any function that might be related to these particular risks, so that we have an opportunity to work on that as an organization. Cyber threats is always a partnership. Governance and compliance is always highly involved in that. We work closely with them in that, and obviously with our IT colleagues. And so when we mention here creating focus groups of 6 to 12 people, those are usually that we're layering in with some of the groups that are already developed. Our enterprise risk management team sits on a lot of the existing committees, both from clinical risk perspective. They're involved in a lot of the IT reviews. We'll be plugging in on the AI governance committee, and then determining action plans for steps that are necessary to help avoid these threats. So some of that, again, and Colin and I talk a lot about the things that he's looking at, especially with the cyber threats. It's more of a partnership and collaboration among a lot of different departments. And then we'll be continuing to report out findings. The workplace violence, we already report out through both governance and our quality team. We talk about more specific, I think, physical attacks in our quality meetings, so that they have more of a line of sight into those types of things. And again, our employee safety, that's something that our workers' comp team is highly focused on as well.
Daphne, why was workplace violence not included in the 10 that went out on the survey?
So it actually was not on the top 10 external lists.
Is that where you got the list?
Correct,
That
yeah.
was from external sources?
Yes, we started with the external, and then we had our...
That's quite an oversight.
Yeah, we had our leaders rank that. It didn't bubble up on the top 10. We had our leaders rank those, but then we allowed them to tell us about other risks that they perceived from an internal perspective. So it's still something that we're going to keep an eye on, because it was an internal risk.
Well, they added some good ones, obviously, that's 3, AI and
Yeah.
patient safety and workplace safety, and
Yeah.
those are important. But that was not on the list that you used from the third-party sources.
It was not.
Well, I hope that...
They took, obviously, a more global approach. And I was trying to see if there was any of these that it might have fallen into, but really it didn't stand out as one that was highlighted separately.
I hope when you do the next annual survey of your leaders, you get 100% participation.
Well, we definitely have talked about how to gain more participation. One of them will be, we took a little bit of a pause because the initial response was even lower. I think we just kind of launched the survey. We probably will be doing more directed phone calls and actually having a dialogue and getting it just in time, because that would be the goal, to have higher participation.
I guess we could buy more soft shell jackets to give out. Colin has any extra
Colin
ones?
did tell me that that was an option, so. It's not in the budget for ERM?
That's all shell jacket.
I'd give mine away.
Any question for our Chief Legal Counsel Officer? Anything else?
That was it on that.
Thank you. think the next one is our
I'm surprised by that retention one.
approval for policy
That surprises me.
LD 1000.
That's top three. Oh, well, cider. But well, they're getting pandemic. They kicked off from all our competition.
Do you want to,
Biggest pandemic.
you got to do your work plan?
Yeah.
Post-pandemic, people.
All right, so we're on 5A here.
Yes.
All right. I do have actually one addition here, so it's the approval of the governance work plan that we talked about earlier. So that is what I'm asking for a motion for is to approve the governance work plan as presented in your red folder.
A motion for approval.
Before we do a motion, can you kind of go back and little history, because this came before us, then we sent it to the board and it's come back to us.
This is the work plan. I'll get to that one in a minute.
This is a work
That's,
plan.
I'm talking about the orientation.
Work plan.
I'll get there next, but yeah.
Okay.
He was just asking the work plan that he presented earlier.
Oh, okay. I was following the next in the packet here. So move to approve the work plan.
Okay.
I move to approve the work plan that Colin presented earlier.
Second.
Second by Dr. Kirby. All in favor, signify.
Aye.
Any opposed? Motion passed. Next
Okay.
one.
The next one is a request to archive JPS policy, LD 1000, orientation for board members, senior management, and leaders of the organized medical staff. This had come before the governance committee and went before the full board, and they requested actually some amendments to it. When we went back and looked, we felt like specifically section 2.4 of COM 9000, which is our corporate compliance program, was broad enough to encompass all of the various specific elements that were listed in LD 1000. And so to avoid the perception that there were specific items that we actually weren't educating on, the existing language of current COM 9000 is sufficient to make this policy obsolete. So we are requesting that it be archived.
Any questions? Nobody?
Move to archive LD 1000.
Second by Dr. Kirby. Second. All in favor, signify. Any opposed? Motion passed. I think that will conclude. Do we have any closed session?
We do.
We don't? We do. So I guess we're going to pause for 5 minutes and then we'll go to the closed session.
Guys, but
Oh, my goodness. Too soon. Did you? Wow.
I'm surprised he still has a job.
You lose
I'm
one
surprised he
game,
didn't get
I was
fired on
fired. He should have.
that game.
Yeah.
That is the only game.
we're going to resume our normal session with no further business. The meeting is adjourned. Thank you. Thank you.
Oh, yeah.